Hello and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you information on a wide range of interesting and important health topics and to introduce you to the great people doing important work across the community. Today, I'm joined by Jessica Chan and Kristen Aberizk. We're going to be talking about the school-based health centers. Jessica and Kristen, welcome to the show.
Thank you.
Great, so I'm so excited to talk with both of you today about school-based health centers and a little bit about the Child and Family Agency. I want to start with some introductions. Jessica, we'll start with you. Tell us a little bit about yourself and what brought you to the Child and Family Agency and to a career in healthcare.
Sure, of course. My name is Jessica Chan. I am the Program Manager of Medical Services at Child and Family Agency. I'm also a pediatric nurse practitioner. So I went to school to become a nurse at UConn, and I always knew that I wanted to work with kids. When I was younger, I wanted to be a teacher, and then found myself really interested in science and healthcare, and found this was kind of a way to bring in both worlds and work with children and also work in a medical setting. So I used to work at Yale as a nurse, and then I went back to school, became a nurse practitioner. I've done a couple years in primary care, but I actually found Child and Family Agency during my clinicals when I was in school to become a nurse practitioner. And I had a friend growing up in high school whose mom was the director at that time of our program. And so I was able to connect with her and ended up working there as a new graduate, and then left, did primary care for a couple years and came back.
That's really interesting. I love to hear about it. And Kristen, what about you? What brought you to Child and Family Agency and a career in healthcare?
And again, my name's Kristen Aberizk. So I have been here at Child and Family for almost 13 years. And before that, I got my degree in rehabilitation counseling. And it was originally, my idea was I wanted to work with adults with any mental health needs that they might have. Through internships, I discovered that my love was really working with children, and especially elementary age children. So after I got my master's in licensed professional counseling, I found Child and Family, and that was actually my first job after grad school. So I've been here for a long time, and there's several reasons why I've been here.
Excellent, awesome, so happy to have you here. Now, some of our viewers may not know a lot about Child and Family Agency. I'd love to give them a little bit of an overview about what it is that the agency does.
Sure. Yep. So Child and Family Agency is one of the leading social support providers in Southeastern Connecticut. We have outpatient counseling services in New London, Groton, Westbrook, and Pawcatuck. We also have early childhood education services. We provide in-home behavioral health. We have psychiatry, and we have our newest urgent crisis center, which is located in New London. And then we have our school-based health center program, which is where Kristen and I work.
Awesome. Thank you so much for that. Now, every day is probably a little different for both of you. Kristen, let's start with you. Tell us a little bit about a typical day for you, what it might look like.
So I have the best of both worlds, where I'm a clinician and still provide direct client care in a school in Ledgelight, Connecticut, and I'm also a supervisor. So my days look very different. One of my favorite days is when I get to actually see kids for session, and then also get to provide supervision to my supervisees in additional elementary schools.
Excellent. And Jessica, how about for you? What's a typical day look like for you?
Of course, yeah. So in my role as program manager, I am overseeing our medical side of our school-based health center program. So at this point, we have 18 nurse practitioners, 1 nurse manager, and we have 5 medical assistants all throughout the school districts. And so I am overseeing some of the day-to-day. I'm consulting on clinical cases that come up. We're a DPH funded program, so I'm often working on ensuring that we are meeting deliverables and outcomes for DPH, working on DPH reporting, doing advocacy for our program, and also spending time working with the Connecticut Association of School-Based Health Centers. So I serve as a board member on the Connecticut Association of School-Based Health. So doing some bigger picture statewide advocacy as well.
Wow, that's a lot of great stuff. Now, I'm so excited. You started talking about school-based health centers, and that's what I want to spend time talking about today. Let's start with how many school-based health centers there are and where they're located.
Sure. So we have 22 school-based health centers, and they're located in Groton, New London, Ledyard, Stonington.
And we have 2 Learn sites.
That's
So our other schools are district-wide, but then for Learn, we're at the Friendship School, which is in Waterford, and then RMMS in New London as well.
And most of those schools are either pre-K, elementary, middle, and high school.
That's great. So no matter where you are in the region, there's probably one near you. That's great. Now, let's talk about the difference between a school-based health center and, say, the school nurse.
Of course, yes. We're often confused for our school nurses or for our school support staff. So the school nurse is really such an essential role in the school. They are responsible for all of the students and often staff as well. They're doing mandated state screenings. They are triaging medical issues and emergencies that are coming up throughout the day. They're giving medications to students who are prescribed medications that they may have to take throughout the school day. As a school-based health center, we function like an outpatient medical clinic or like a pediatric primary care provider in the school, but we are not their PCP. We're not the primary care provider. In our clinics, we have master's level nurse practitioners and master's level licensed professional counselors too, or social workers, so providing our medical and our behavioral health pieces. We are functioning like a pediatric office. In the medical side, we are doing physicals, vaccines, acute visits. We can diagnose kids with strep, the flu, COVID. We are giving all sorts of school recommended and required vaccinations. We do a lot of preventative medicine and education. So if students have asthma, diabetes, if they're struggling with nutrition, we do nutrition counseling. We prescribe medications, so we can save families a lot of time. They can come in and we can see the students throughout the school day, so they don't have to leave school for an appointment if there are transportation issues. We're able to see them. We can either call the parent in or Zoom them into appointments, or the parent can come be present.
And one of the main differences between my role as being a school-based clinician and a school social worker is I have the ability to meet with kids and provide mental health assessments, provide diagnoses, and really assess for any symptoms, behavioral health symptoms that might be kind of getting in the way of a child's functioning. And as we've talked about, we are employed by Child and Family Agency, not the school district in which our school is located.
Those are some really important differences. Thank you for sharing all those resources. What a great resource for the kids at school. Let's talk a little bit about what it takes to enroll in the school-based health center. Who's eligible for services?
That's a great question, and it's a very simple answer where everyone is eligible for services. One of the most important points that we try to communicate with school and whoever is interested in having their child enrolled in the school-based health center is there is really one step where they need to complete a registration, and that can be provided we have several QR codes that they could enroll their student in, and it's really just demographics and some information about insurance. And one of the common misconceptions is that anyone can access the school-based health center. They don't need to have insurance. They can be underinsured, or if they do have insurance, they can they can be eligible for our services.
Yeah, so unlike our school nurse partners and our school support staff partners, they're responsible for every student in the school. We can only see a student who's enrolled. So a parent or legal guardian has to sign the child up before we're going to provide services.
That's great, really important to know. I know sometimes when I do back to school nights for GASP, sometimes I'll be there and I'll see a clinician or whoever's in charge of school-based health center looking to enroll students. So I know that you guys do a lot of outreach, which is great. Okay.
We try to make it as accessible and easy as possible for caregivers.
Yes. All right, we're going to take a quick break. We will be right back with more Healthwatch.
Email from school about the incident today.
Scary.
You know, teachers like me, parents, we don't always know as much as you guys do about what's going on with other kids.
Half the time, it's rumors.
Yeah, but if you're ever concerned about a friend who's having trouble with alcohol, prescription drugs, anything, you need to tell an adult, someone you know and trust. That can be hard, but speaking up about a problem is what helping a friend is all about.
Welcome back to Healthwatch. I'm so excited to be here today with Jessica and Kristen from Child and Family Agency, and today we're talking about school-based health centers. So let's pick up where we left off. We were talking a little bit about eligibility for services and enrollment. Next, I want to talk about, once you're enrolled, how do you actually make an appointment? What are the next steps?
Yeah, so while we're not school employees, as Kristen said, we collaborate so closely with our school nurses and our school support staff and administrators and the teachers. So they are most often our leading referral source. So on the medical side, I can speak to, a kid will go to the school nurse, they'll have something going on, school nurse will refer to us if they think it's something that we could assist with. So for those sick kids or kids with chronic illnesses, or as the school nurse is responsible for all of the students in the school, they're making sure that physicals and vaccines are up to date, the kids are compliant and not going to be excluded from school. So if they have a list of students, they'll provide that to us and we can help get those kids physicals and vaccines as soon as possible, so that there's no delay in them either starting school or staying in school, making sure they don't get excluded. So oftentimes it's a school nurse. Families can self-request, and a lot of times our teenagers, middle and high school, often will self-refer. So they'll come down to the school-based health center, they get to know our providers, and they'll knock on the door and say, hey, I have a sore throat today, can I be seen? So.
And similarly for behavioral health services, parents can call and self-refer their child. If a teacher or social worker notices that there's some changes in a kiddo's overall functioning, they can always get permission from a parent to make a referral on their behalf. We also often get referrals from pediatricians or other outpatient providers in the community.
That's great. Such important information. What a great resource. Our kids are so lucky to have it in their schools. Now let's talk about, we've covered a few of these topics already, misconceptions about school-based health centers. What are some of the most frequently asked questions, things that people are still unclear about?
One of the most common questions I get is, well, are your services free, or will my insurance be billed, or will I be billed? And there is a beautiful answer that we can share with parents, and that is that there's no out-of-pocket cost. We do bill insurance, but parents will not be responsible for any financial bill that there might be.
So we do have families on that note who will say, well, I have insurance, so I don't need the school-based health center, and I'm not eligible for the school-based health center. We always tell families, whether you have insurance or not, you're eligible. Everyone's eligible. If students don't have insurance, we'll work with the family and try and help them get insurance so that they can access care outside of school-based as well without having high costs. Another misconception that we often hear is families will say, well, I have a pediatrician, I have a pediatric primary care provider in the community, so I don't need the school-based health center. We are never there to replace a primary care provider. And in fact, we want all of the students to have a PCP in the community because we're there during the school day. We're not there on weekends. We don't have on-call in the middle of the night. And we're not an emergency room, so we can't serve those functions. And so we often will work with families if they don't have a primary care provider and link them with someone in the community. We work with our community providers to help supplement what they're doing. So if a family is unable to get an appointment with them, or the family doesn't have transportation to get to them, we can help by seeing the student, and then we will fax our note, or we make phone calls out to our local pediatricians as well to let them know what's going on, what they were seen for, if we prescribed any medications. We really want to make sure there's continuity of care, so that if we're prescribing something on a Friday and something goes on a Saturday and they're reaching out to their primary care provider, they can look at the note and see, oh, I see, you were seen in your school-based health center. This is what happened. We'll pick it up from here. So we really try to collaborate closely with them as well.
Wow, that's great information. Real wraparound services, it's great to know that there's so many ways to access healthcare when you need it, in school or out of school. All right, switching gears a little bit to talk about public health and healthcare and how, we are all constantly advocating for what we do. Sometimes we really have to make the case to decision makers about, what it is that we need to do the important work. Do you find yourself having to do a lot of advocacy work in your roles?
You use the word constant, and I would reiterate that word, that yes, we're constantly advocating, whether it's within our school district or on a statewide level. And actually, last week, Jess and I both spoke at an appropriations budget meeting just to advocate and explore the need for financial compensation to keep our school-based health centers open and running efficiently.
Yeah, this is a fitting time for that question because we are in a current legislative session. And so we every couple days are hitting new people at the agency to write testimony or go up to the Capitol and provide oral testimony as well. There are a couple things right now that are hot topics for us. We're a private nonprofit, and we are not an FQHC, a federally qualified healthcare center. So we don't get the same reimbursement rates for the services that we're providing, even being the same services. So being that in that non-FQ status, we are trying to get more Medicaid reimbursement for the visits that we are doing to make sure that we're sustainable. We've been advocating for statewide for nonprofits to receive increases in funding, including for cost of living adjustments. And then our strongest advocacy right now at CFA is that we received a fantastic grant last year. We were a part of a statewide and national school-based health alliance grant where we got over $2 million to open 9 new school-based health centers in our community. So those are located in Ledyard, Stonington, and then Groton and Grosso Tech. So 2 elementaries in Groton and Grosso Tech High School. We are now advocating for continued funding for those sites. That was a one-time grant. And so now we need some continued funding to keep those up and running and keep our staff there. They've been very successful. We've integrated really well into those school districts. And so we've had our own staff, and like I said, providing oral testimony. Some people went up to the Capitol for a school-based advocacy day a couple weeks ago. So it's constant.
Yeah, it's important. Have a lot of different agencies that are trying to sort of sometimes compete for funding. Grants can be very competitive, so I can definitely relate with that. Let's talk about your favorite part of what you get to do at work. What do you find the most rewarding, and what are some of the favorite aspects of the work that you do?
I think there's so many, especially it's a true testimony, especially Jess and I have been at the agency for multiple years. And part of my job is I get to do a little bit of a lot. So I provide individual therapy, family therapy, group therapy. I would say something that I've really taken great pride in is I've been trained in several EBPs, evidence-based practices, and specifically in a model called CBITS, which we're during the day here at school, there's several children who are able to be a part of this curriculum, and we teach not just coping skills, but how they can reduce any symptoms of anxiety, depression, PTSD. So one of the most rewarding things I see, especially in that group, is differences from kiddos from our first session to our last session, and having them feel more confident in talking about their feelings. They're able to advocate for themselves, and feel that they've really reduced their symptoms and can function more effectively in the home and school setting.
Yeah, for me, there are so many things that I love about my job, and I think it's really cool to be in a position where I can come to work and be like, I really truly love my job. And when I was working in the clinics primarily, it was always working with the children. I was in elementary school with Kristen at one point too. We were at the same site, and the elementary schoolers are just hilarious. So it's, you never know what your day is going to look like, and you could be dealing with some really heavy or traumatic things, and the kids just are so resilient and they make things lighter, and they'll just make one comment and it just lightens up the entire day. So currently in my position now as program manager, I love being able to support my staff, but I really love being able to do things like this. So going to schools and going to the state capitol and being able to share what we're doing, because it's so important. And I talked to so many people in the community who are like, what's a school-based health center? And I didn't know what it was until I was in my master's degree program and started having clinicals in a school-based health center. I was like, this is so cool. I never knew that this even existed. So I think just wanting to broadcast to everybody, like this service is here and it is awesome and it's so important, and we're able to be a safety net and catch so many students with things going on that just may not be, they're not the loudest students who are coming forward and saying I'm having an issue with this, but they might be, and we can catch them and help them get services. So I love being able to market ourselves and go to schools and be present for the community.
That's amazing. And your passion, both of you, it really just shines through. So I've loved hearing about it. Now, lastly, let's talk about how if people want to get more information about Child and Family Agency or the school-based health centers, where's the best place for them to go?
So we do have a website, childandfamilyagency.org. And then we also have a main line that you can call, and they can give you more information about kind of where you would like to be seen, whether it's a school-based health center or an outpatient clinic. And that number is 860-437-4550. And client support specialists will help navigate you to best suit your needs.
And I absolutely recommend people visit the website. On the school-based program, we have a video on there currently running from our advocacy day. So we have testimonials from students and families and school staff as well, who have shared how school-based services have impacted them. We also have some events on the website coming up. So Child and Family is hosting a Touch a Truck in May and a golf fundraiser. And so those are things that people in the community can participate in and learn more about our services. We're going to be having representatives from all of our programs at those events so they can share more.
Great. Well, I have to thank you both for being here with me today on Healthwatch. It's been so great hearing more about Child and Family and the school-based health center. So thank you so much for joining me.
Thank you.
And to our viewers, thank you so much for tuning in today. We hope you'll join us right back here on Healthwatch.